So good afternoon. I'm really pleased to be sharing with you my perspectives on HIV prevention in Asia, what we have achieved. As we all know, achievements are very important to celebrate. These milestones build momentum to achieve the final stretch to ending the HIV epidemic. I've spent the last 7 years in Thailand, so most of my examples will be in Thailand, but there are so many other examples throughout the Asia region. So I think it's important to start with where we are with the HIV pandemic in Asia and the Pacific. As you recall, we started this epidemic in the 1980s with the first cases detected in Asia, and we've come a very long way since then with a windy road, with changes in the epidemic. As of 2019, there are over 300,000 new HIV infections in the area, and over 100,000 people have died. Key populations represent most of the new infections, with more than a quarter of new infections occurring in youth, ages 15 to 24 years of age. Because the epidemic is different throughout Asia, both the stage of the epidemic and target populations, the approaches have really varied. However, many of the control steps are the same, with common goals of reaching, treating, preventing, retaining, and care. Some countries in Asia and the Pacific have really met their mark, with 90% of people knowing their HIV status, 90% on treatment, and 90% of those virally suppressed, as well as demonstrating HIV reductions. But there are other countries that are having challenges to meet that mark and are finding new HIV infections on the rise, such as the Philippines and Pakistan. With an epidemic that primarily impacts key populations, there's been a focus on high impact interventions at each level of HIV prevention and treatment, including PrEP demand and addressing barriers, index and self-testing, gender affirming service delivery, flexible service delivery models, same-day ART, reducing stigma and discrimination, viral load testing, HIV self-testing and recency assays, as well as access to once-a-day fixed dose ARVs. I think the similarity in all of these reaches is simplicity and efficiencies. There's also the recognition that sharing best practices between countries is very, very important and can enable success. Recently, there's been a technical connection created between 12 countries sharing best practices, and the list of the countries are there. The practice elevates the technical competence and capacity and leadership in the region. I'm pleased to share the Thailand Ministry of Public Health and the US CDC have had a long-standing partnership, now over 40 years, with goals to work together to end the HIV epidemic in Thailand. And these goals of this collaboration also stretch to other areas in public health. We recently celebrated many achievements that are highlighted here, including expansion of ARV treatment, PrEP policies and implementation, and others. Without going into great detail about these achievements, I think there's some lessons learned that it takes time, hard work, integrated approaches, collaboration, and champions. Some issues have propelled Thailand forward, including growth and capacity, a willingness to consider gaps and connect with partners for technical expertise, interest in the policies that would support implementation and program, also highlighting demonstrated successes so the work is measurable and impactful and propelled forward. And then continued focus on research to grow the knowledge and innovate, bringing the best possible approaches for programs to the country. One particular example is the prevention of mother-to-child transmission of HIV infection in Thailand that started really with research in the 1990s on short course antiviral treatment regimens. It moved into policies, demonstration projects, and really wide-scale multi-sector commitments to this goal of eliminating mother-to-child transmission of HIV. And then it finally translated to the certification of the elimination of mother-to-child HIV and syphilis in 2016. When I step back a little bit to consider HIV prevention achievements in Asia and take a broad view, I see 5 main themes. HIV treatment, as highlighted, many countries are moving towards improved care and treatment, reaching for goals set on the cascade. HIV prevention, increases in PrEP in Asia with varied progress across the region. HIV laboratory, which includes scale up of viral load testing, rollout of recency assays, and HIV self-testing. Also reductions in HIV infection, which shows clear demonstrated reductions, which are the fruits of the labor of the programs. Finally, HIV research advances. So new biomedical prevention products or behavioral interventions can really propel forward the advances. There's some that are proven and many more on the horizon. I want to highlight where we're seeing some successes in the region, and these settings are drawing upon a rich and diverse pathway on improving HIV treatment with goals on the treatment cascade. There are some countries that have reached 90, 90, 90 and are now working to 95, 95, 95. I wanted to share some of the recent achievements of Thailand on treatment, HIV treatment, that exemplify some of the innovative approaches to treatment. For example, they include same-day ART initiation or SDART, which is now recommended in the Thai National HIV Treatment and Care Guidelines 2020. Implementation of differentiated ART service delivery nationwide. Decentralization of ART service to primary healthcare settings. Decentralization of ART service to primary healthcare settings. Development and approval of 3 new law requirements for CSO health workers to provide HIV services in Thailand, and introduction of innovative information technologies such as line applications and electronic data interchange. Also, laboratory achievement that feeds into a HIV treatment achievement is HIV self-tests. They are now authorized for sale and awaiting approval by the Thai FDA. In 2021, Thailand is the closest ever to reaching 95, 95, 95, with treatment coverage overall at 84% and viral suppression at 97%. And Thailand is going to be focusing on efforts on reducing the remaining gaps across all age, gender, and risk groups to reach epidemic control. You can see on the top of this slide is the overall achievements, and on the bottom of the slide are the achievements in the groups of men who have sex with men and transgender women. The UNAIDS report for Asia and Pacific 2020 was called Seizing the Moment, with a highlight of achievements of antiretroviral access and treatment, even if targets for 2020 were not met. The pandemic of COVID has really become a challenge for meeting these targets. As you can see, the number of HIV infections was 3 times higher than the goals. This slide shows the President's emergency plan for AIDS relief for PEPFAR-supported countries in Asia and the number on treatment. The supported countries across the region have had over 2 million persons on HIV treatment. And as you can see, there's been increases since 2015. I want to move to considerations for HIV prevention using PrEP. There are many more mobile resources. Here's an example of one which provides a guide to PrEP access in the region. These resources make it easier to access PrEP with very easy to use features to find locations of PrEP, costs of PrEP, and they really work to eliminate barriers to access of PrEP for people who need it. I wanted to highlight a PrEP success of Thailand. Since the research data has clearly showed the efficacy of oral daily pre-exposure prophylaxis, or PrEP, in 2010, policies and programs have followed. One of the leaders on PrEP implementation is Thailand. And as you can see, the growing numbers of PrEP, there have been many steps taken to advance implementation in Thailand, including policies, working towards access and reducing costs. Key population-led PrEP implementation has been a real success in Thailand, as demonstrated in the blue in this graph. And this can provide an example in the region for how to successfully scale up PrEP delivery. Overall, there's more limited data about progress towards PrEP in many other settings outside of Thailand and Australia. Government policy and strategy, resource commitments, and other commitments are needed to scale up PrEP. But even in Thailand, as you can see here, with where there's been advanced PrEP demand and really an emphasis on implementation, it's only reaching about 13% of those that need to be reached. The cornerstone of successes in treatment and prevention are laboratory capacity. Being able to target programs based on recent infection, being able to have testing that's easy and accessible with same-day testing are all a part of the support for achievements. Viral load testing has been expanding in the Asia region, with all countries moving to have many settings for viral load testing. Not included here is the use of recency assays, but those have also been expanded in the region to focus prevention efforts. There is also a lab community of practice that's been developed for the Asia region, which allows countries to share tools, experiences, and expertise to build on the capacity for laboratory successes. With regard to new HIV infections, there's overall been great progress in Asia region. This slide has the PEPFAR supported countries with progress and new infections and mortality from 1990 to present. You can see overall reductions in both new HIV infections and all-cause mortality in people living with HIV. Although there's been great variability within the region with these successes, overall a landmark achievement. We have been seeing reductions in new HIV infections at Ceylon Community Clinic in Bangkok, Thailand. This data is from the voluntary counseling and testing at the clinic since it's been open in 2005. And it's from an open cohort assessment, meaning persons can come and go and they are tracked in the clinic so that we can measure HIV incidence. As you can see, the HIV incidence peaked in 2009 at about 5.4 per 100 person years and then declined. This corresponds to enhanced prevention efforts in Thailand, including treatment for all, no-cost HIV testing, and PrEP availability since 2014. Finally, I'd like to say something about research achievements. There are a number of recent HIV research advances that include both behavioral and biomedical research. But one of the most important recent achievements is the finding of efficacy for the first ever long-acting pre-exposure prophylaxis, or PrEP, called cabotegravir. This study was done by over 40 sites around the world, and 3 sites in Thailand and 1 site in Vietnam were a part of the study. This study found superior efficacy of cabotegravir long-acting, which is an injectable formulation, compared to daily oral PrEP. This next slide shows the study data in an intention to treat or an intent to treat analysis. Shows on this slide, there's the cumulative HIV incidence comparing cabotegravir injections to tenofovir emtricitabine. In the orange is the new HIV infections that occurred in the cabotegravir arm, and in the blue are the new infections during the study that occurred in the tenofovir emtricitabine or Truvada arm. There was overall significant reduction of new HIV infections among at-risk men who have sex with men and transgender women on cabotegravir compared to the control arm of tenofovir emtricitabine. There was overall a 66% reduction in new HIV infections. And this data is very important. It's being used to consider licensure for the product, and the product may be available in global settings in the years to come. This is very important to have additional prevention options available for different populations. I think some of the HIV research achievements also can be applied to the COVID pandemic. And one of the things that's been developed over many years for HIV research is networks of different research sites that contribute to finding new biomedical products and evaluating them. These research platforms around the world have been a concerted effort and have been used for with a shift towards the COVID pandemic. Specifically, these platforms such as the HIV Prevention Trials Network, the HIV Vaccine Trial Network were used for COVID Research Network, specifically for vaccine clinical trials, and were renamed during this time as CoVPN. The COVID pandemic research portfolio has also used a very similar integrated research model that has been used for HIV, which includes considering research needs for prevention, treatment, and other research on monoclonal antibodies or infusion prevention and treatment options. We all know that we're in a new era with the COVID-19 pandemic, and goals have been hard to achieve during this redirection of focus. But there's been considerable barriers, structural barriers to treatment and prevention. Just to name a few: closure of clinics, hospital, schools, loss of jobs, and difficulty with transportation. But I'd like to redirect us and to consider that there's been opportunities as well with telehealth and mobile prevention to really readdress accessibility and the needs for flexibility. Some of these specific impacts of COVID on HIV activities in Thailand include reduced demand for clinic-based HIV testing services, delayed and reduced viral load testing appointments, limited access to ART clinics, and canceled, and many in-person trainings, meetings, and site visits have been canceled. Some of the adaptations have been including offline approaches, like the online to offline approach for appointments, increasing viral load testing at other sites, augmenting use of telehealth and express services, having differentiated ART service delivery models, and increasing virtual meetings and online trainings. Last, I'd like to highlight the importance of continued innovations in HIV prevention work. And key population-led treatment and prevention is key. As communities are at the center of both the HIV and the COVID pandemic, service delivery needs to take a lesson from the community, because this is how we reach the most vulnerable populations. Some of these highlighted adaptations in this slide, such as telehealth, express services, and STI self-sampling, has allowed the communities to be better at reaching targets for HIV treatment and prevention. These innovations need to continue and expand and to really reach those that need the services. It's important to highlight the HIV prevention achievements, but it's also important to consider what is needed for the final stretch. What's required are continued champions and partnerships and flexibility and innovations to serve those that are most vulnerable. We've had a lesson learned around community-based partnerships, but also community-led activities. We need to have resilience and new models ahead as well. We need the ongoing commitment to reaching the goals and the resources needed. And we can use these electronic methods that have really been expanded during the COVID pandemic to reach our goals. Telehealth, electronic reminders, applications to enhance treatment and prevention, and there's more ahead. And I'd like to end my presentation with a quote from Eamon Murphy of UNAIDS that is very insightful. In 2020, the world's attention has been focused on COVID-19 and how the pandemic is impacting people's lives and livelihoods. COVID-19 is showing us once again how a global public health threat is interlinked with other challenges such as unequal access to services, insufficient human rights protection, gender inequality, gaps in the social safety net. To get the regional response back on track will require putting people first and tackling the inequalities on which epidemics thrive. I'd like to thank many people that helped me with this presentation, but sharing their slide sets, and also the CDC DHAP program, where I lead the activities at the Siloam Community Clinic, our Community Advisory Board, our Thailand MPH US CDC collaboration, and many people that helped me. But especially at the end here, I would like to acknowledge and recognize the leaders and champions who are continuing to work on the HIV epidemic in Asia and the world. Thank you.